Hello, everybody, and welcome to the latest episode of the ALS United Mid Atlantic Goals podcast. I'm Tony Heil with ALS United Mid Atlantic, and if you've listened to our past episodes, which we have been doing for over a year now, with over 50 episodes, you'll know we've talked with people with a wide variety of perspectives when it comes to ALS. That includes people who are living with ALS, people who are caregivers, people who've lost someone to ALS. It includes researchers and others who are focused on the science of finding new treatments for ALS, and it includes some of our care staff, nurses and social workers and others who provide their experience and their knowledge about how they can help people living with this disease. And I'm really excited because we've also talked with a lot of people who are part of our wider ALS United network across the country. And today I'm going to be talking with Cassy Adams from ALS Northwest. We did a video a few months ago, last year, with Cassy, where we talked about how we're attacking ALS from coast to coast, from Ocean City, New Jersey, all the way to the Pacific coast, because that's what our whole network is. We're helping people from across the country to provide the best in patient care, advocacy, and research. And Cassy is a terrific advocate for her families and her area, and as you'll hear today, every member of ALS United has their own unique ways of supporting the ALS community, and we can learn from each other. So, Cassy, thanks for talking today.
Thank you so much, Tony, for having me. It's a pleasure.
So, how long have you been at ALS Northwest?
Yeah, so I'm coming on about 9.5 years that I've been here at ALS Northwest. I actually started as a care services coordinator. My background is in social work, and so I did not have a personal connection to ALS. I actually came in because I really was passionate about working with people with disabilities, people who were dealing with end of life issues. And I sort of fell into this work and then fell in love with it. And since my time here, I have served as the care services director, and then also now I'm currently our executive director.
And with that, don't you think the world would be a much better place if we just had more social workers solving problems?
So I'm a little bit biased, but absolutely. I've always said, social worker as president, social worker, just, it's a lens that really takes into account the person's individual experience, but also their family, their system that's around them, and then the larger sort of macro system of our society and the way that things work, which I always try to have that lens in everything that I do, and especially when working with people with ALS. It's just a really important perspective to have, that we're focused on supporting individuals and their families, but we're also advocating, and we're also looking at the bigger picture and how we can collaborate effectively with partners and other healthcare providers to support folks.
I know we have social workers that we employ here at ALS United Mid Atlantic, and you have your care team. But I know that the job description is something that's on paper, but social workers, most of what they do here is not in their job description. I'm sure that's your experience too.
Absolutely. And I think we'll have a lot of similarities, Tony, with the way that our social workers and care coordinators, we don't always employ social workers, but we have really dedicated care services coordinators and social workers who go out. They meet people within their homes. They connect in with people at coffee shops. Sometimes it's, a text. It's really however we can meet people and show up for folks, but not just home visits. I mean, we're out there doing support groups, managing a loan closet program to get people accessible, durable medical equipment, advocating for people with an insurance company that's not wanting to fund something. There's just such a myriad of activities in the ways that we help folks. And yeah, there's no cut and dry. Wearing lots and lots of hats is sort of a more appropriate job description for our care team.
Yeah, I think whether it's social worker or other ways of describing members of our care teams, the job description could just be care services, and they're like, "Oh, I know what they're doing."
Yeah,
Like,
yeah,
because every day is different, because every
yeah,
person is different in what they need.
yeah. And one of the things that we really pride ourselves on and care a lot about here at ALS Northwest is really supporting people where they are. And we mean that in a couple of different ways, quite literally where they are. So we really make it a priority to actually go out and do a home visit with every single person who's diagnosed shortly after they receive the diagnosis and are connected in with us. And we feel like that's a really important way for people to get to know folks. We are very clearly, embedded within our ALS multidisciplinary clinics, but we also feel it's really important that folks know that we're a resource outside of the medical institution and that we're here and we can sit down with people for 3 hours at their home, meet their family, meet their dog, connect in and get to know them as human beings aside from just the ALS diagnosis. So it's a really important part of what we do. And we also know that people are emotionally and mentally at different points, in their experience with ALS when they receive a diagnosis. So we're also really just meeting people where they are emotionally and mentally, and we just want folks to know that we are here when they're ready. We're here to support them, to guide them, follow them through clinic, support them with support groups, equipment, all, really anything and everything that they might need along the journey, but when they're ready to do that.
That's great. And what is the footprint of ALS Northwest? Because that could be Northwest Texas, it could be Northwest
Right.
Florida, but I know it's not.
So we're in the Pacific Northwest. Our home base is here in Portland, Oregon, which actually I am a native of Portland, Oregon. Love this state. So we cover the entire state of Oregon and also 6 counties in Southwest Washington.
And are you still in the 90s? Because that's what I remember about Portlandia, is that the dream of the 90s.
We kind of are. We kind of are. Although Portland has had a huge housing boom over the last several years, we've had a lot of Californians move up, and we try to be really nice about that. We do love our neighbors in California. But we're very proud to be Oregonians and Washingtonians and folks here in the Northwest. We can be a little cowboyish. We like to kind of be on the cutting edge of things, and that's no different from the ALS community. There's a lot of really strong advocates and people who are really striving for great change here. We serve generally around 600 people living with ALS in our regional territory. And one of the kind of unique things, probably similar to other states, is that we do have some very central metro areas within the state of Oregon and Washington, but we actually have a lot of rural communities here in the state. And one of the things that we're really passionate about is helping to support people to get access to care in their local communities. We have 5 multidisciplinary ALS centers that are here in the state of Oregon. The majority of those are concentrated in the Portland metro area. So one of our kind of big strategic plans over time is to see how we can really encourage clinics and centers to maybe embrace even a hybrid sort of model of care in more rural communities, because it's a long haul for people to drive 4, 5, 6 hours from rural communities all the way out to the Portland metro area. So that's something we're really passionate about, and really wanting to find those clinics and providers who are passionate and interested in starting clinics in rural communities.
Well, first, as a Tony myself, I'm in favor of Tonians of any sort. That's all I can. I'm a big fan of. But seriously, though, I think that the issue of rural healthcare, especially for our ALS community, is something that we all are looking at more because, with the way things were 6 years ago, and it was so reliant on telehealth, and now we're looking at how we can continue that support and go beyond it. Because I'm sure if you have care staff that are seeing people in their homes, there's it's one thing to be on camera, it's another thing to be in person, and that can take all day to go see one person now, as opposed to other things. So,
Right.
What are some of the ways that you are helping to make sure that the people in those rural communities are getting the same level of respect and care as someone who lives just 5 miles from the clinic?
Yeah. As you're pointing out, it's a constant adjustment, and it's something that I think we're going to always have to work towards. One of the ways that we really try to manage that from the get-go is that we actually have care coordinators who are living and working within those regional areas. So our staff is really spread out throughout our regional territories. We have someone out in Bend, Oregon. We have someone in Southern Oregon, and they're really, they're connecting with all of the people in that region and can easily get out and, do a day trip and go out and see a couple of folks in their homes. I think they're also really critical because they're the ones who are making those really important connections with with the PTs and the OTs and the other clinic the folks who are coming in and doing home health services for folks with ALS, providing education and information about ALS and ALS Northwest, and helping to sort of bridge some of those gaps with healthcare providers who may just have less familiarity or experience.
I think that's what makes ALS United such an important organization, whether it's ALS United Mid-Atlantic, ALS Northwest, ALS United Greater New York, all these organizations we have is our local connections, because what you're just speaking of is so familiar to what we have here in Pennsylvania, New Jersey, and Delaware, are that these communities all have their own unique cultures and identities. So,
Yes.
you mentioned Bend. There's if I imagine even there, your care services staff, they know, okay, these people go to Walgreens instead of this place, or you need to make sure that they're getting this kind of service, or they respond more. Like, you have to talk about their cultural needs
Yeah.
that maybe you don't even think about if you're in another part of the state.
I couldn't agree more with that statement. I mean, my experience as someone who lives in the neighborhood that I live in Portland is different from someone across the river. And that's just Portland we're talking about. So, there's so much diversity throughout the state. And, as we know, Tony, like people with ALS are just, you know, they're just people. They have this diagnosis. So it's not just about where they live and their community, but it's also just the diverse needs of individuals. And I think what's so special about ALS United members is our ability to really prioritize just getting to know the human being who's in front of us. We're here to support them with their ALS diagnosis, but first and foremost, we're seeing them as a person, and we're getting to know what their interests are and helping them to live as fully as possible with this diagnosis.
And I know that we all have our unique way of managing our organizations that fit our areas or that we've heard from our local ALS communities. You were telling me about things that you guys are doing in terms of volunteers and caregivers. Can you tell me a little bit more about how ALS Northwest is helping with those issues of volunteers and caregivers?
Yeah, absolutely. So I was really excited to be able to launch our volunteer program formally in 2023. Kind of shortly, a couple of years out of the pandemic, people were sort of ready to get back out and engage in the community. And this is something that we had been talking about for a really long time. So we launched what we call our Helping Hands program. And essentially, for lack of a better reference, it's kind of matchmaking. We have volunteers who reach out to our organization who say, I really want to give back. Many of them people who have lost a loved one to ALS or have just a personal experience. And sometimes it's just a person who hears about us on the radio or went to one of our walk events and felt inspired. So what we do is we get to know those volunteers. We have them go through a training process and get to know what their interests are and how they would like to support people with ALS and their families. And then we match them up with a family who is looking for that level of support. And we do anything and everything from having volunteers go out and help with yard cleanup to organizing projects. We actually had a woman who had ALS who had been an avid crocheter, and she had been working on some Christmas presents for some of her family members. And when she lost the ability to use her hands to finish her crochet projects, we found her a volunteer who crochets and came in and continued her inspiration and allowed her to give those gifts to her family members. So it's not caregiving. It's really giving people the opportunity to connect in a meaningful way, in often really creative ways that people with ALS may otherwise just decide to give up on because they don't necessarily want to ask for that level of help, or they might just not have somebody in their family who can help do those kinds of things because they're helping to provide care and managing medical appointments and everything else.
And the things that people might be bringing up in those conversations are things that you would never have thought. You're not thinking of, let's involve crochet,
Right.
and then someone else brings it up. It's like, oh, well, it percolates up instead of top down.
Exactly, and it's been really I found it very inspiring and really just watching the relationships that develop between volunteers and the families that they're working with is really, from my perspective, what it's all about. Frequently it's just a conversation initially about, hey, as an organization, how can we have a volunteer help take the load off of you and your family? And then months later, you check in with this family and the volunteer, and they're friends, and they have deep and meaningful conversations. And we find it goes really both ways. That the volunteer is, of course, helping the family, but the volunteer feels that they are being helped in exactly the same ways, and it's a really healing, beautiful program. So we've been really excited about the growth of that program. And we've been focusing a lot on making sure that we are, as much as possible, finding those volunteers and those ambassadors in all areas of the state. So it's also been a really good experience for us to do a lot more outreach and get more people in, coming back to those rural communities, more aware of ALS and more engaged in ways that they can help.
That's terrific. And one of the ways I know that you also are looking at helping people is looking at the whole ALS family, including college savings
Yep.
and things of that nature. Uh, I know when I talk to people with ALS, they tend to be not young. So, maybe as young as we have people in their early 20s as well, but like 50s, 60s. And so when you talk to the people with ALS, they're often more concerned about their spouse and their kids and their families than they are for themselves. They're often more selfless about the disease. And so what you're doing is really addressing those needs that they have as a family member. So tell me about how you're looking at the future for the ALS families.
Yeah, yeah. Well, I 100% agree. The majority of people that I talk with, especially those with kids in the home, are often so selfless. They're really focused on, how can I take the burden off of my family as much as possible, and how can I support them in their future. And this was something that we were hearing a lot from the younger members of our community who had kids at home, saying, I'm worried about the future of my kids when I have to stop working, or even my spouse has to stop working to care for me. How are we going to make sure that our kids have access and opportunity to financially afford a college education or a vocational path forward? So we put our heads together, and we actually ended up talking with the Oregon Treasury Network. And the Oregon Treasury has a really great program, and I know many states offer this, but we were able to connect in with their 529 plan, which is essentially an investment plan for college education and vocational programs for young people. And it's a very solid growth over time. And what we were finding was that a lot of the families that we talked with either had never heard of a 529 plan, or they had heard of it, but in the chaos of ALS, they're like, that's like the last thing we've been thinking about. Maybe we put in a few bucks here and there, but we just really haven't moved forward on planning for that. So out of really generous donors' generosity, we were able to start a fund where we can disperse basically initial seed grants to families who have a parent who is either living with ALS or who died of ALS, and essentially seed fund 529 plans for some of these young kiddos. And the feedback that we've received from the family has been some of the most really, really meaningful to me, in just saying things like, we didn't have the opportunity to prioritize this in the midst of caring for our loved one, or continuing to just deal with the myriad of things that come up with ALS. And this is something we think about and we talk about all the time. How are our kids going to manage in their future? And I'm just so grateful that we're able to take even just that small little piece off of their shoulders to say, hey, let's help you get this plan set up for your kid. Let's go ahead and put some initial money into that pot so it starts growing. The family can contribute to it over time. And eventually, when the kid's ready, they could take those funds and go to culinary school or go through a vocational trade program or go to college. And we're really proud. We launched this a couple of years ago, and I can't wait until we can see some of these kids graduate and use this fund to really, continue to support their future.
That's really so awesome. And I'm sitting here writing notes about like, okay, how do I figure out how to make something like this work in parts of our area? Because um, we talk about the number of people that we serve, and well, we should triple that because it's not just a person with ALS, it's their spouse or direct caregiver, and it's their kids, and it's their parents. There's a lot of people involved with an ALS case. So, here we talk about how in a given year we'll serve up to 1,500 people in our region.
Yep.
And so, really, it's at least 4,500 people in some way, shape, or form that
Yep.
we're here for.
Yep.
And so, for you, that's you're easily close to 3,000 people, or
Yep.
that you have some sort of support for, even if it's just offering some advice.
Absolutely. That's so true because, I mean, we say this all the time. Person who gets the ALS diagnosis, has the diagnosis, but the whole family gets the ALS diagnosis. Everybody in that person's system is impacted. And we do a lot for family caregivers because we find that often it's typically a spouse or an adult child, sometimes a sibling. They are really reaching out for that kind of initial support, like, hey, I don't know what to do, or how can I be the best caregiver and support to my partner or my person. And we have quite a few caregiver support groups that we run on a monthly basis that offer the opportunity for family caregivers to come together with other family caregivers, share sort of their feelings, whatever they're going through, but also a lot of practical tips and support. We launched an ALS Caregiver 101 program a couple of years ago that's been really successful. We've got some great feedback. And it's really kind of a boot camp. We bring caregivers together and they hear from different providers from our ALS clinics who are talking about certain subjects and really kind of like having a Q&A discussion with people just around really practical things that come up a lot for folks. So a lot of it's trying to just break down the barriers and make sure that family caregivers are not feeling alone, that they have peers in their community. And another program I'm really excited that we launched a couple of years ago is our mentor support program. So we actually match folks who served as a family caregiver for their loved one, who come back to us and say, I really, I have so much knowledge, I have so much experience. I really want to be a mentor support to someone who's going through this. I kind of understand that, being in the thick of it and really the need for someone to just cry on the phone with or connect with in a meaningful way. And that's been a really meaningful program just to be able to connect folks and give them the opportunity to share in their experience.
It reminds me of this phrase I heard from reading a biography this year, noticeably improving people's lives. Like, as a nonprofit leader, you are going to be more successful at fundraising and awareness if you're delivering results. And we don't have a result of a new cure. We have some new great research and treatments, which we can talk about.
Yeah.
But you're not going to be able to get people to continue giving money and or volunteering if you're not providing real benefit. And these are things that people are going to remember, not just now in the moment, but generationally.
Yeah, I think people give to organizations and to initiatives that are making a tangible difference in people's lives. And I feel the same way. I give to a variety of different organizations, and it's because I see the meaningful impact of their work. And that's something that we talk about a lot. Is at the end of the day, we always come back to what's our mission and what are we doing, and how is it impacting the ALS community. is it giving people a positive impact in their life? And if it isn't, then we shouldn't be doing it. If it is, building those relationships, if it's providing education and giving people a sense of community, then we always know we're on the right track.
Yeah, and really, if you're always mission focused, then you don't have to think about being mission focused.
Right.
It's just what you do.
Yeah.
So it's kind of like if you're never lying, you don't have to focus on lying because you are doing your thing, and people will it comes naturally what you're doing, and then people it's how you earn trust. It's how you're always bringing things back to what you got to do, and it becomes a muscle reflex.
Yeah, 100%. I was thinking, Tony, just as you were talking, that I feel like we can do that best. Over here in our little neck of the woods in the Northwest, we do that best because we can also collaborate. I'm here today because we, actively collaborate all the time. And with our other ALS United members and other ALS organizations and community partners, we're at our best when we can work together. I was so excited to recently join some of the ALS United members in Washington, D.C. a couple of weeks ago. We did some really great advocating on the Hill, particularly for the Act for ALS Act reauthorization. And I'm just personally really excited about all that ALS United is accomplishing together and how much more we can do in the future.
Yeah, and I am very jealous that that was the one year I couldn't go. So I'm there every year. Like I even went to DC a couple years and it was just us and ALS United North Carolina,
Right.
and I like them a lot. You can listen to the podcast I do with Mary Graham's, but scheduling wise, I couldn't go, and it was the year when everyone's there, and
Darn it.
I
Sorry
can't
to
pull out
rub
my
it
hair
in,
'cause I don't have
Tony.
any. It's okay.
We're doing it again next
But
year, 100%.
But we also collaborate through our mission focus on research.
Yes.
And I know that we all do that in a lot of different ways, sometimes together.
Mhm.
And you guys have been joining some of our wider efforts on research. So can you
Yeah.
talk about that?
Yeah. Research is a really important pillar within our mission as an organization, and has been since we launched. So to date, we have actually ALS Northwest has invested $3 million in ALS research over the last 24 years, which I'm incredibly proud of. Those who
Right.
came before me really pushing for ALS research, and we continue to do that. So in the name of collaboration, as you said, ALS Northwest has contributed around $350,000 to the ALS Network's innovative research program, which is so exciting. This program is really focused on sort of high risk, high reward science projects. And what I think is really cool is it's really, the word innovative. It's really focused on like cutting edge, like, hey, when we take a risk in research, we're accelerating the opportunity that we're actually going to find the cure. We're going to find the cures. We're going to find the life-sustaining treatments. If we play it safe in research, that's not going to cut it with this disease. So we've made contributions towards that program, and I'm actually so excited because Dr. Faranak Fatahi, who is the associate professor at University of California, San Francisco, we actually helped to fund some of her initial work. And she's actually going to be coming and speaking at our research symposium that we're holding in Portland on October 24th this year to share sort of like the project that they're working on, and some of the kind of, what they can share about some of their early results. But it's a really interesting program or project that they're working on. They're actually looking at glial cells, and kind of what sort of are they driving towards ALS progression, and just not responding to damage. So they're testing a small molecule drug to protect the glial cells from stress, with the sort of end of course hypothesis or result of preserving motor neurons. So I'm really excited about the work that they're doing, and really looking forward to being able to just continue to support really interesting and cutting edge projects moving forward.
And I know we talked about rural communities, and whether it's rural or smaller towns, sometimes you feel like, am I involved in these big research projects? So if you are in Tioga County, Pennsylvania, or if you're in Bend, Oregon, or you're in Lower Delaware, you're still just as instrumental in the direction of research by pulling our resources and awareness and advocacy together.
100%. Last year, we actually invited all ALS folks to come out to
Hmm.
our research symposium. We're doing the same thing again this year. And I love that program because it really gives
Yeah.
people access for those who may not be eligible for clinical trials. I think it's so important for folks to know that they still absolutely have a place in research. And the ALS registry is still really active and needs, as many people as possible to fill out their questionnaires. So there's always ways we can find for people to engage in research. It may just not look like a clinical trial, but I'd always encourage, anybody who's listening, make sure you're talking to your ALS United organization or to your doctor about ways you can contribute because there's so much happening out there in the research space.
So there's always things we can learn about research and about care, but as you said, you came to ALS Northwest through your other work. When you joined, what surprised you most about learning about ALS?
Gosh, I think a lot of things, but what just immediately came to my mind was how, and I think I probably knew this intuitively, but it's just been proven time and time again just how incredibly resilient human beings are and how incredibly resilient the ALS community is. I can think of hundreds of people that I've talked to over this my journey at ALS Northwest and their journeys and just getting to know people and getting potentially the most devastating news of their entire lives and how many people grapple understandably with that, but also see it as an opportunity to support others, to engage in advocacy efforts, to help, engage in research to sort of help the next person. Just how, like, I think you mentioned it earlier, Tony, like how selfless people can be and also just how incredibly resilient the humans are, how we can really take something this devastating and try to find ways to live meaningful lives amidst ALS. And that's helped me in how I perceive and look at how I live my own life, which is a huge gift. Huge.
I 100% agree. It's really hard for me to hold personal bitterness or grudges. Like, there's a lot of people in this world I don't like. Let's be honest. There's a lot of things in the news I just like. I gotta
We're not meant to
move
like
away.
everyone.
But
Yeah.
yeah, but when it comes to like personal life, it puts everything in perspective. Where in a way where I walked in the door today, I'm doing okay. My family's doing okay.
Yeah.
We have our own
Sure.
struggles, but being involved in ALS really gives us a healthy perspective on living.
Yeah, it absolutely forces you to consider how you're living your life and to have perspective and to really try not to take so many things for granted.
Yeah. So I can't take the ALS United Network for granted. I'm so glad to be part of it. I'm so glad of all we're able to connect with our patients and our staff, our caregivers, our volunteers, our families. I'm so glad for the network we have with ALS Northwest as well. So if people are listening and they want to learn more about ALS Northwest, some of these unique programs,
Yeah.
maybe some of our donors and board members and supporters here are going to listen and be like, hey, let's do that there.
Yeah.
Where should they go to learn more?
Absolutely. Our website is a great place to start. We've got a ton of information, tough contact information for all of our team members, including myself. Happy to have anybody reach out. But you can go and visit alsnorthwest.org and learn more about us. Our staff is really happy to talk and connect, and we'd love for folks to reach out and maybe even come visit. Tony, we got to get you over to Oregon at some point.
I would be thrilled. I've never been to Oregon, and nothing against Chicago, which I know we'll both be there this summer
Yeah.
for a get together. I've never been to Chicago either, but I was looking forward to going to these places in the country. I'm like, Chicago is fine. So don't don't tell Julie at ALS Chicago that I said
I
that. I
will
mean,
never
I'm
tell
happy to
her.
go, but there's a lot of places in this country I'd like an excuse to go to, and Oregon is high on that list.
Oh, it's a beautiful place, very green. We have a lot of really cool things to see. So yeah, for any of your listeners, if anybody's coming to Oregon, let us know. We'd love to host you at our office and show you around and connect with our partners.
Well, thank you, Cassie. Thank you for all you're doing for your patients and families and the ALS mission. Again, if you're listening here, you can find all of our episodes on YouTube and Spotify and iTunes. Go back to past episodes. You can email me if you are interested in sharing your perspective or have some questions at tony@alsmidatlantic.org. And you can visit our website, alsmidatlantic.org, or follow us on social media at alsmidatlantic. Pretty easy to find. And Cassie, thank you so much. I know together we're going to make a big difference in the lives of people with ALS.
Thank you so much, Tony. It was a pleasure.